I'll share with you a few more interesting cough remedies. I want you to open page 60, please, medicine number 4. Page 60, medicine number 4. I'm trying to share with you remedies perhaps that you haven't used in the past. Coccus cacti. Anyone used it? Coccus cacti. Coccus cacti is prepared from an insect, I presume. Very useful remedy, especially for children and adults. This is page 60, medicine number 4. The name of the remedy is Coccus cacti. Not cactus, not cocculus, but coccus.
And
it's stringy, it's sticky. What happens? They're hemming and hawking. Why? There's some mucus which is stuck here, right? This is a very common thing patients will tell you, any age group. Some mucus which is stuck here. I'm trying to bring out the mucus. I'm not being able to. So I vomit and that brings out the mucus. So cough ending in vomiting. Why it's ending in vomiting? Because there is mucus which is stuck there and it's a sticky mucus. They're not being able to bring it out. So they gag and vomit out the mucus. They vomit out the mucus. It's a beautiful medicine, works wonderfully in acute cases. If you haven't tried Coccus cacti, you're missing out on a very, very useful remedy. In 30C and 200C, these are not organopathics, but these work well as an acute 30C and 200, right? You again, try to use it in correlation with remedies you use. You use Ipecac. Whenever cough ends in vomiting, you're using Ipecac. You're using antim-tart. Not helping, try Coccus.
30C, you said?
30, 200, yeah, it works really well. If you see in Coccus, I want you to open Boricae, please, Coccus cacti. Respiratory section. Constant hawking from enlarged uvula. So this is the hemming and hawking. Second line, accumulation of thick viscid mucus. Viscid is sticky. So there is thick mucus in the throat. Tickling in the larynx. You got that? See few lines later in italics. Whooping cough attacks ending with vomiting of this tough mucus. They vomit out the tough mucus. Another very interesting modality about coccus is cough when brushing. You'll see a group of patients who will tell you, when I brush in the morning and they put that inside the toothbrush, they vomit out that sticky mucus. I'm sure it mentioned somewhere cough on brushing. In the modalities, worse when brushing the teeth. Respiratory. Yeah, brushing the teeth causes cough. So that's another interesting thing about coccus. But it's mostly an acute remedy, to be honest. It won't help you in chronic cases, but the acute state, it can really help you to subside that acute episode. Try it. You won't be disappointed with coccus. Brushing the teeth causes the cough. You got that? So hemming and hawking, step 1. Step 2, thick mucus is there. So trying to bring it up. Once they vomit, they feel better because that sticky mucus is gone. The irritation subsides. Now how to differentiate this with Rheumex? Have a look. I think it's in the handout, please. Rheumex. What's similar with Rheumex? Medicine number 16, page 66. Rheumex crispus. Rheumex, the similarity with coccus. Rheumex also does this. Rheumex will also do this. But you ask Rheumex, is there anything in the throat? Rheumex will say no. It's just a tickling in the throat. It's just an irritation in the throat. And what will Rumex do?
Cover up.
Always cover up. Rumex always needs covering for the throat. Only that makes them better, right? Always the neck is wrapped up because they're very sensitive to cold air in Rumex. So tickling is similar in Rumex like Coccus, but in Coccus, the decisive question is you feel any mucus in the throat? Coccus will say yes to that, Rumex will say no. There is no mucus in Rumex throat. And always very sensitive to cold air in case of Rumex. So Rumex also is a wonderful medicine for that condition, but there is no mucus in the throat of Rumex.